Hello guys, this is Dr. Palaniappanmanickam, a gastroenterologist focused on your gut health. Did you know that there are 100 billion bacteria in your oral cavity, which is the foundation of your 100 trillion bacteria in your gut? So I'm going to teach you 3 tips in this video to take care of this oral health, which will in turn make sure that your gut bacteria is good, which will help you in the prevention of diabetes, hypertension, and also from watching my channel. Let's dive deep into it. There are 700 species of bacteria in your oral cavity, and this is the entrance to the entire gastrointestinal tract. As a matter of fact, the oral cavity also has good bacteria and bad bacteria, and the presence of what kind of bacteria in your oral cavity can actually dictate what kind of bacteria can be there in your entire gut. For example, there is a bacteria called Porphyromonas gingivalis. If you have this a lot in your oral cavity, the good gut bacteria can actually decrease, resulting in diseases. On the converse, alternatively, on the reverse, if you have gut problems and GI issues, your oral bacteria can also be affected. So it is a two-way communication, which is absolutely important in terms of your long-term health. My friend Askdocpal's oral health is very good because he keeps on doing exercise called eating. So we're going to talk about 3 common mistakes that people do that damages the oral health. Let's dive deep into it. Best and worst bedtime snacks. Yogurt, almonds is best, and ice cream and chocolate is worst. Hey, any bedtime snack is actually worse, and even worse is chocolate and ice cream just before you go into bed. So when you eat sugar, not necessarily candy, bacteria feeds on the sugar, secretes acid. This damages the enamel, which is the outer layer of the teeth, and causes it to lose minerals in a process called demineralization. So in due course of time, with repeated exposures, the acid keeps damaging the enamel more, leading to a small hole in the enamel, which we call as cavities. If your stomach is always filled up, you will end up filling up your cavity. So maintaining a neutral pH as much as possible by limiting acidic foods and not eating late at night will help this demineralization. One of the most important factors is saliva. Your saliva actually maintains a neutral pH and helps in remineralization. So when you're eating late at night, it changes the pH of the saliva, and hence the remineralization process is getting delayed. And that is why overnight fasting or time restricted eating, which we absolutely love, a minimum of 12 hours is absolutely essential, so that the saliva is given the time to help in remineralization process. So the first step is don't eat anything late at night. My Bengali friend Abhijit Chakraborty has no problem in maintaining the pH of the oral cavity because he just salivates just by seeing Bengali sweets. And I have seen many patients complaining of halitosis, which is bad breath. And the most important tip that I usually give my patients is flossing and tongue cleaning. So there are different ways of flossing that you can try. The most common method of flossing is using a thread, and that goes in between the teeth, which it could be a free-flowing thread or a thread attached to a small stick, similar to that what you saw in the video. It goes in between the teeth or between upper and the lower, and you'll be able to take the food particles, rinse your mouth and clean your mouth. The other convenient way of flossing that I use all the time is to use an electric toothbrush which has a flossing mode attached to it already. So what I do is I use the Soocas toothbrush, which is similar to any electric toothbrush, helps in cleaning the tooth surfaces. So I brush in the morning and also at night before I go to bed. But after 2 minutes of brushing, it has 2 modes. One is the deep clean mode where I use for brushing, and after the 2 minutes is over, there is a 5-second vibration reminder which is automatically switching the brush into a quick floss mode, which will help you to 1 minute of flossing all over the teeth. See, the ultra fine 0.6mm water stream coupled with high vibrations will help to remove the food particles between the teeth, so you don't have to actually use a string, which is very convenient for me. As I travel a lot, I take this to each and every place. This has been a lifesaver for me. If you are interested, check out the link in the description, and thank you Soocas for sponsoring this video. Your donations are going directly to Punnagai Pookal, a free school for cerebral palsy kids, autistic kids in Madurai. Please check it out, and the link is in the description as well. He's brushing the dinosaur itself. My son absolutely loves this video. I always wonder how dinosaurs brush their teeth. There are so many teeth, while we are finding it difficult to brush our 32 teeth minimum 2 times a day. People always forget the nighttime brushing. It is absolutely critical because that is one little tip can actually help good bacteria in your oral cavity. Let's say you eat dinner and don't brush your teeth and you go to bed. The food will actually help the bacteria to thrive, and bacteria multiplies, and just imagine they have 6 to 8 hours to multiply and you don't have any control over it, and most of the times it is a bad bacteria that is being multiplied in the oral cavity. So these bad bacteria forms a film called plaque surrounding the teeth, and if we keep on doing this in 24 hours it might form a tartar, which increases the risk of gum disease and cavity formation. This will in turn affect the gut bacteria balance, decreasing the good gut bacteria and increasing the bad gut bacteria. So I know that many parents are making the kids brush their teeth at night, but they forget to brush. My friend Saranakumar always brushes his teeth at night without fail so that his wife Tirupura Sundari doesn't find out the alcohol smell. The third most important tip is flossing. Exactly. So you just take a little thread and then floss in between the teeth. Hey, what are you doing? I've seen that happening multiple times as well. So when I was growing up in India, I know nighttime brushing was a routine, but flossing has not been a routine. Maybe it is changing right now, but flossing is absolutely important. The main reason, let me tell you, while you are brushing, it doesn't matter whether you brush 2 or 3 times a day, there are certain areas of the teeth and the oral cavity that you will not be able to get to at all. Brushing actually helps the surface of the teeth, but there is a lot of plaque material, bacteria and food particles that go right in between the teeth. So you need a small thread-like structure that goes in between the teeth, and then you floss and you take the food particles out. You will be surprised how much amount of food particles are in between the teeth despite you brushing 2 times a day. So when you forget about these food particles, again bacteria thrives, which is not a big problem for you if you're not worried about your oral health, but it is a big problem for you if you want to keep your gut health good on a long-term basis. So I cannot emphasize how important oral health is for your gut health. If you want to make your gut health better, please focus on your oral health. Please follow these 3 steps. Number 1, not eating late at night. Number 2, nighttime brushing, don't forget. Number 3, flossing. If you have never heard about this word flossing, hear about this in this video today. Remember, gut health is important not only for your overall body, especially for your belly fat. Remember, one belly at a time. It is absolutely important. I'll see you in the next video. Bye-bye.